Welcome to True Health Tuesday, and the truth will set you free. Now, please like this video, subscribe to my channel, comment below, and send this video to your loved ones. This helps my channel grow and reach more and more people with this vital health knowledge. Now, this subject is home. How does chiropractic care affect the body? What do we do? When you look at chiropractic, we are the largest drugless healthcare profession in the world. And it's a triune: philosophy, science, art. And let's delve into that. B.J. Palmer, one of the founders of modern chiropractic, quote, "There is no effect without a cause. Chiropractors adjust the causes, others treat the effects." Let's go over what chiropractic is not. We are not alternative healthcare. No, we are not muscles and bone doctors. This isn't for back pain, neck pain, or symptom relief. If you look at back pain or neck pain, it's an alarm. It doesn't mean that you should cover that up with medications. You got to find the problem and fix it. Now, what chiropractic is, we are a unique and distinctive healing art. We are doctors of the autonomic nervous system. This means that you've got two switches: stress or regeneration. This is what we look at. We identify and correct vertebral subluxations, and we'll go over to the science behind that. And their goal is to restore the normal form and function of the body. Now, chiropractic is based on vitalism. Vitalism, the number one, is the body has an innate inborn intelligence, that the body is intelligent design. Now, dis-ease occurs when the body's natural ability to heal is interrupted. Subluxation, which is a mechanical dysfunction of the vertebrae that blocks the normal function of that autonomic nervous system. And this means your body gets in that stress state. Correcting subluxations remove this interference, and the body's innate intelligence is able to function fully and properly. Vitalism is based on healing only occurs when your body's own healing powers are activated. The body is self-healing and self-regulating. Again, quote from B.J. Palmer. Medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. One of my instructors said, "Would you invest in somebody that only studied poverty throughout the world?" You know, that's why the medical system is not real good on health. But let's look at this. Okay, when you look at the body has this automatic nervous system. One part keeps you alive under stress, and that's sympathetic or fight or flight. The other part regenerates tissue. Now, let's look at the patient before. Hypertension, that's ATN, and type 2 diabetes. Now, are these really diseases or conditions? Now, when you're looking at, obviously, there's a physical stressor. Now, physical, chemical, or emotional stress will activate this. Imagine if you dropped a brick on your foot. That puts you in significant stress, and that causes the heart rate to go up, and it's going to shut that blood supply to the gut or from the gut, which is where neurotransmitters are produced. Your gut is 90% of your immune system. You're looking at this is literally how your body regenerates. That blood goes from that gut area to the arms and legs so you can run away from danger. And the liver starts breaking glycogen down to glucose. So literally high blood pressure and type 2 diabetes is a stress response. It's not from lack of medication. Now, what we do, we actually identify the physical stressors on an x-ray. And here, 90 days later, not correcting the high blood pressure, not correcting the type 2 diabetes, because that literally are stress responses. We correct the cause. So you correct the physical cause, then the blood pressure normalizes, and then the blood sugar is going to normalize. It's really that simple. Now, the benefits of chiropractic care, obviously, alleviating pain is going to be the last result. The pain is only an alarm. Now, of course, it's going to boost productivity. Of course, it's going to improve the quality of life because you've got the autonomic nervous system. One keeps you alive under stress, the other regenerates tissue. If that's balanced, then you can adapt to the world correctly. Improves cognitive function. It reduces your dependency on medication, improves the quality of sleep, reduces the stress, and boosts your immunity. And then this is according to the Journal of Spine, the Journal of Vertebral Subluxation Research, JMPT, multiple journal articles. So what is it? A vertebral subluxation It's a vertebra that's lost its juxtaposition in relationship to the vertebrae above and below, affecting the nervous system. Sub means less. Lux is light. Ashan is denoting a result. So this is the result of lack of light, that intelligence that should be flowing through the body. Now, this is the inability for your body to adapt, if the subluxation is present, to trauma, toxins, and thoughts. Now, there's 5 keys to this. 5 keys what happens. First, kinesial pathophysiology. And you're going to see there's a normal cervical spine, there's a side view of the neck on the right, and then a reversal of the curve. So first, the kinesio means there's an alteration in movement. This triggers an alteration in the nervous system, or the neuropathophysiology. And then that's going to spasm out the muscles, or that's the myopathophysiology. And if those muscles are spasmed, limiting motion, then the vertebrae, literally, the discs change. The structures change. And this is the histopathophysiology. Literally, the cellular matrix changes. And then this results in the disease, or the pathophysiology. And this is why when you're treating just the muscles, when you're treating just the pain or the symptoms, you're not addressing the cause. Now, there's a direct relationship between structure and function. This nervous system controls and coordinates every function of the body. Does it control hormone function? Absolutely. Brain function, digestion, every system. And this is why it's encased in this vertebrae. You get the solid bone up here, and you have all of these vertebrae that are designed to move and bend and turn and twist, but it protects that nervous system. Now, let's look at the side view of a normal neck. Beautiful curve in the neck. Now, when you're looking at the lower end, prostate cancer, breast cancer, pancreatic cancer, they all have a reversal of the curve. Now, this isn't the cause of cancer, but does it put that body in a stress? Absolutely. Now, knowing that the nerve to the diaphragm comes out of the middle portion of the neck, C3, C4, C5s, if you have a compromised position, motion, could that diaphragmatic function be compromised? Obviously, it's going to put you in a fight or flight state, and that's going to decrease your body's ability to produce healthy cells, because you've got those 2 switches, stress or regeneration. So knowing that the body has 4 detox pathways: respiration, perspiration, bowel movements, and urination. With that reversal of the curve, could that be negatively affecting that function? Absolutely. Then if you look at the picture above, the 90-day checkup, that's the same patient. There's less of a reverse curve. It's starting to get the curve back. I mean, that's the key. Curve in the neck is called the arc of life. And when you look at this, the discs need that motion to get nutrients. There's 70% fluid. But if you have an alteration in motion, that alters the nutrients going to the disc. Then the disc becomes smaller. And then the bones change in order to stabilize that joint. And this is when you see those bony changes, the bony distortion. It's literally the body adapting to altered movement. Now, this can absolutely affect what houses in that spinal column, the nervous system. Now, when you're looking at this, and this is how stress kills, or one of the mechanisms of stress kills. Everybody knows that if you irritate the diaphragm on the left, and this is where the heart is, this is why you have left jaw, left arm, left shoulder pain, because the diaphragm is connected to the left or the trapezius. The diaphragm on the left is connected to the left trapezius. And this is why you have those referred pains during a heart attack. What's not really known is that the diaphragm on the right is connected to the right trapezius. Now, under any kind of physical, chemical, and emotional stress, that liver's got to work harder to process the stress hormones. Because under any kind of stress, physical, chemical, or emotional, your adrenalines are going to produce the cortisol, you're going to produce the epinephrine, norepinephrine, or adrenaline. And all these stress hormones, they go through the body, then they have to be filtered through the liver. So the liver, also in Chinese medicine, is called the emotion organ. So it's got to work harder and harder and harder. Now, when you're looking at the x-ray at the top of the rib cage area, the first 4 vertebrae of that rib cage area, that thoracic area, supply the heart. And now here's a theory, and this is the off button. So under physical, chemical, emotional stress, the liver's got to work harder and harder and harder. That right trap is pulling those vertebrae over because of the increase in tone. Eventually, if those vertebrae go over so far, and this is a theory of how stress, one of the mechanisms that stress kills, is those vertebrae, the T1 through T4, the sympathetic nerve supply to the heart, get pulled over so far, eventually it fires a sympathetic charge down into the heart, putting the heart in ventricular fibrillation, stopping the heart. And that is one mechanism. But the heart has two nerve supplies. That's one of them. Now, by correcting this structural deviation and restoring that normal function, does that help the patient? It's going to restore that communication of the brain to the body. When we're looking at the curve in the neck, you've got a normal, beautiful arc in the middle and two reverse curves on either side. Now, when you know that anxiety, stress, depression, bipolar disorder, schizophrenia, impulse control are all features of that frontal lobe is controlled by the cerebellum in the back, and the position and motion of the vertebrae communicate to that. Plus, that brain produces its own food called cerebral spinal fluid. Now, if you have a normal curve, that fluid can drain and give nutrients to the spinal cord. Pulling or throwing that head forward, reversing the curve, literally pulls on the brain stem. And this is going to not allow that normal flow of cerebral spinal fluid. So what does reverse curve, loss of curve in the neck, how does this affect the body? Doctors of chiropractic are doctors of the autonomic nervous system. You only have two switches. One keeps you alive under stress. And when you're under stress, the blood goes from that gut area, which is the immune system, neurotransmitter production, tissue production, and it flows to the arms and legs so you can run away. When you're running away from danger, obviously the liver is going to change. It's going to start breaking glycogen down to glucose to elevate that quick energy, that blood sugar. So this entire system changes whether you're in stress or regeneration. And this is why when you look at this, parasympathetic nervous system is located in the cervical and the pelvis area. So does this mean if you've had pelvic or cervical traumas that parasympathetic, the rest, digest, and repair might not be working correctly? Well, what does the parasympathetic do? It stimulates the immune system, repairs tissue, increases blood supply to the gut, and literally all repair mechanisms. This is how your body regenerates itself. What does the sympathetic nervous system or the fight or flight? Now, this is located in the thoracic and lumbar. Obviously, there's a structural deviation that's going to put your body in a stress state. But what this does, it's vital. It keeps you alive under stress. Now, it increases heart rate, increases blood sugar, increases blood pressure, increases low-density lipoprotein, the cholesterol, increases stress hormones, all in a normal response to keep you alive. This is why you need this to activate it so you can get up and start the day. But it also decreases blood supply to the gut and decreases immune system function. So everything has to do with this automatic or autonomic nervous system. Now, loss of the curve in the neck. It figured a head weighs between 12 and 18 pounds. For every 1 inch forward head carriage, the pressure on the disc double. So when you see people with 2, 3, 4 inches of forward head carriage, that's rounding over their shoulders so they can adapt. So what does this loss of curve or forward head carriage do? Well, when we look, according to Alfred Bragg, medical doctor, the loss of cervical curve, the arc of life, stretches the spinal cord between 5 and 7 centimeters. This produces pathological tension, putting the body in a state of disease. Loss of cervical lordosis reduces the patient's lung capacity by 30%. Remember, you've got 4 detox pathways: respiration, perspiration, bowel movements, and urination. So if your head is forward, loss of curve, obviously that's going to affect how your body can breathe. In multiple journal articles on that. Loss of curve in the neck weakens the immune system, organ disease, muscle tension, and increased sensitivity to pain. Core, 1979. Forward head carriage or loss of curve and atlas subluxations block normal neck motion and dramatically reduce the amount of endorphins produced. This results in many otherwise non-painful sensations or experiences as pain, like in fibromyalgia. It's so brilliant when you look at this. You need proper motion and alignment of the spinal synovial joint is a genetic requirement for health. And a lack of proper motion of the spine represents a stressor. And it's so clear that if you have altered position and motion of the vertebrae, you have altered stimulus to the brain. If you have normal position and motion of the vertebrae, you have normal stimulation or communication to the brain. It's really that clear. So I get a lot of questions, and one of them is, how do I find a good chiropractor? Well, we have 7 questions. And what I tell people is, man, all you got to do is have somebody say yes to 5 of the 7 questions. That would be good. We're lowering the bar, but at least we got a bar there. Okay, number 1, do you take x-rays? Why? Because this is essential to identify the physical stressors that this person has been under. Okay, you cannot use symptoms with 90% of the nerves coming off the spine. And you need an objective analysis that you can measure to show that there is a problem. Now, do you get listings off the x-rays? And this is what chiropractors will do. They'll literally mark the x-rays to see where they're going to adjust. Because some people will just take x-rays so they can bill insurance. The question 3 is the most important. Do you take post x-rays to document the structural changes made? Okay, you've got a loss of curve in the neck. Am I correcting it? I don't know unless I take another x-ray. Or is the disease, damage, degeneration of the spinal joints, is that being corrected? You can only tell with a post x-ray. Now, are your treatment goals to reshape and restore the natural curves of the spine? Is it? Because some people are just working on symptoms. And again, 90% of the nerves coming off the spine, there's no pain fibers. So we're looking to restore the normal form and function so the body can adapt correctly. Question 5, are you familiar with correcting disc injuries? Obviously, if you're doing pre and post x-rays, you're going to see the discs that are compressed start to regenerate. The discs are alive. Do you work on post-surgical patients? Now, the surgery has a horrible success rate. You're looking at 70% plus failure rate in most of the cases. And this is crazy. So you cannot work on the surgery site, but you sure as heck can work above or below the surgery site, hopefully preventing future surgeries and hopefully helping the patient adapt. But again, that's a skill level. And can you reverse arthritis? You figure the most common type of arthritis is called osteoarthritis. Now, arth means joint, itis means inflammation. Osteoarthritis is a non-inflammatory joint condition. Why is it in the arthritis category? Who knows? And it's also called degenerative disc disease or degenerative joint disease, which it's not a disease. It's from a trauma. So when you look at the most common type of arthritic changes on the spine, they're from a trauma. But if people knew that, they'd say, well, it's a trauma, fix it. I know, just find somebody that says yes to 5 of those 7. Again, quote from B.J. Palmer, and I love this. This is so beautiful. We chiropractors work with the subtle substance of the soul. We release the imprisoned impulse, that tiny rivulet of force that emanates from the mind and flows over the nerve cells to stir them into life. Ah, beautiful. So when we talk about the 5 keys to health, this is what we mean by proper nerve supply. You have this automatic nervous system, could be in a stress state or regenerative state. We need that in balance to reverse a disease process, but also to restore normal, healthy production of tissue. 5 keys to health: regular exercise, hugely important. And because movement is like, you move every joint every day, you got all your joints healthy, but movement is a battery to the brain. So altered movement means altered stimulus to the brain. Proper nutrition. This means your great-great-grandparents, same diet for 10,000 generations. Healthy, organic, free from preservatives, varied. And then sleep, deep restorative sleep. This is when the body regenerates. This is when that parasympathetic nervous system, the rest, digest, and repair is activated. And then prayer and meditation. I recommend daily, just like bathing. Okay, prayer and meditation, you get in that parasympathetic state. You're able to connect with a power greater than you. And absolutely essential. You hit all 5 of these keys, then your body can maximize tissue production. Now, for any questions or comments, please post it below. We're going to get to as many responses as we can. We do have to still divide up the questions. The ones that are more sensitive, I'll have to put on our site, the Dr. B VIP site. God bless you all. Stay healthy, my friends.